Hi, everybody, and welcome to episode 47 of the Pet Behavior Chat. So we're going to be talking kitty cats today, and I want to talk about a topic that is quite complex, but they're behavioral signs that we sometimes see in cats, and they're sometimes kind of put into the or under the umbrella of abnormal repetitive behaviors or compulsive behaviors. And I'm talking about feline overgrooming, sometimes also called psychogenic, alopecia, and pica. So pica is basically the ingestion of non-food items. So that's the cats that kind of eat rubber or string or toys or hair bands or chew on flip-flops or basically just eat, but that means swallow non-food items. And we'll talk a little bit about the difference between kind of normal exploratory and play behavior and when it actually becomes abnormal. So I think we're going to kick it off with feline overgrooming, aka psychogenic alopecia. And as you guys might have gathered from previous podcast episodes, we always need to know what's normal before we can label it abnormal. So it's really important that we know what a cat's normal kind of grooming schedule looks like, how often they would groom, how long they would groom for in a 24-hour period. So these time budgets are really, really important, because only when we know what's normal can we say, this is actually abnormal, or it's, not within the realms of normal feline behavior. So normal feline grooming behavior, depending on which kind of source or which textbook or which research paper you read, it can be between 4 and 15% of a 24-hour day. Or if we split it into a sleep versus awake time, so cats usually sleep for about 12 to 16 hours per day. So the other way of looking at it is saying, out of the time that they're awake and not asleep, how much time do they spend grooming? And that's quite a big amount. So cats would spend between 30 and 50% of their awake time grooming. So that's important to know. So we need to know what's normal in order to know what's abnormal. So anything that would be massively above that number or those numbers would potentially go into the realms of being abnormal or kind of not species typical grooming behavior. Now, the other thing that we need to think about is how cats groom. So what would be their normal kind of pattern? What does it look like when you watch them grooming? And cats have this very kind of ritualistic way of grooming themselves. The grooming of their face is actually a stereotype behavior. So it's what we call it's a motor function. So it's a behavior that when they start it, they usually go through that whole sort of behavioral pattern. And if you look at cats when they're grooming normally, it would be kind of long, sort of rhythmic grooming strokes with their tongue. And like I say, it takes on this very sort of ritualistic patterned approach. So the way that they groom their head is, with their paws, and then they go in this typical motion from the back to the front, behind their ears to the front of their ears. And then they lick again. So they lick the medial part, the inside part of their paw. And that's a very ritualistic behavior, but also the rest of their body. It's long, kind of slow tongue strokes. It's not sort of fast and erratic. It's quite it's quite a sort of a ritualistic behavior, as I said. So that's what we need to look at as well. Is the actual grooming behavior different? Are they in the middle of doing something and then they'll suddenly stop and they'll take like really sort of short, fast grooming strokes, maybe to the back of their legs, their thighs, or their tummy. So that's something to look at as well. And then finally, are they spending more time, or are they paying more attention to any particular area on their body? So oftentimes that can be their hind legs. Sometimes kind of their inner thighs are very typical for this sort of psychogenic alopecia. So they might completely overgroom the insides of their thighs or maybe their abdomen to the point where, they're almost bald. So we've got kind of hair loss. Their hair's getting very thin, very sparse. And it's usually symmetrical, oftentimes on both sides of either outer thighs, inner thighs. Belly can be that kind of ventral abdomen area. That could almost be like a perfect sort of square if they're overgrooming their tummies. Sometimes they can overgroom also on their front legs, the inside aspects of their front legs. So these are all the things that we want to be looking at. So it's the time that they spend doing it. Are they doing it massively more than would be appropriate, would be normal? What does the pattern of grooming look like? Is it this slow, rhythmic, ritualistic pattern, or is it fast and erratic? And then finally, is it, are they paying more attention to certain areas of their bodies? Is it bilateral? Is it symmetrical? Or is it maybe just one area of their body? So those are all things that we want to look at, and it's going to inform the diagnosis that we make and whether it actually is psychogenic. So is it a behavioral problem or is it something else? And this is a really, really important point because we have a couple of really lovely papers. There's one really important paper, which is by Weisglass and Landsberg, 2006, which actually looked at overgrooming cats. And it was looking at, are they overgrooming because of behavioral reasons, so psychological reasons, or are they overgrooming due to medical underlying disease? And the amazing thing that they found in this paper is that 76%, so over 7 out of 10 cats, were actually overgrooming because they had an underlying medical disease. And that's really, really important because we can very easily jump to the conclusion that this is a behavioral problem, that it's an abnormal repetitive behavior, that it's a compulsive behavior, and we might kind of go down that route. But actually, we really need to rule out the physical disease first. And so what could it be if we're thinking about physical disease? And in cats, it can be a number of different things. So the one obviously really important thing is ectoparasites, so fleas. Cats can get what we call flea allergic dermatitis, which is where they're actually allergic to the flea saliva. So it's not just that they have fleas, but when the fleas bite, they also cause an allergic reaction. And that can be really itchy and really uncomfortable for cats. And obviously, they're going to overgroom. And that tends to be more sort of on their dorsal back, so on their upper back, maybe kind of towards the tail base. You can often get thinning there. So that's something that we really need to look out for. The second thing could actually be allergies, so hypersensitivities, and that's, again, something that we need to rule out. And there are a number of different ways in which we can do that. And at that point, we probably need to maybe bring a dermatologist in on the case, or, we need to be looking at doing some allergy testing or maybe an exclusion diet to start off with, but it could be environmental allergens. So going down the route of that workup, and, if you're a vet listening, you'll know exactly what I'm talking about. And if you're a cat caregiver listening, that's where you need to kind of consult your vet, and they'll take you through that whole process. And then finally, the other really big sort of underlying physical piece is pain. So do we have any areas that are painful? And in cats, especially if they're overgrooming their ventral abdomens, we're often thinking about bladder disease. So we're thinking about feline idiopathic cystitis, maybe, which I've done a couple of episodes on, podcast episodes. So if you want to know a little bit more about that, I'm going to drop into the show notes the episodes that looked where I was talking about feline idiopathic cystitis. So if they're overgrooming that ventral abdominal area, that's a really big thing to look at. So if we've ruled out the physical, let's say we've ruled out all of our physical medical diseases, and we're left with a conclusion or the very likely diagnosis that it's probably behavioral, what could be some of the causes here? And there obviously can be a number. I would say stress in cats is a really, really big one. So we know that cats especially oftentimes express stress through physical kind of presentations, and overgrooming could definitely be one of them here. So stress is a big thing to look at. So we want to be looking at the environment. We want to be looking at the social environment, the physical environment. So by social environment, I mean, are there other cats in the home? Are there other pets in the home that could be causing stress? Has there perhaps been a change in family dynamics? Has a new baby joined the family, or has anybody else moved into the family? Have we had a change in environment? Have we, moved into a different home? Or have perhaps the caregivers been on holiday recently and the cat's been staying in a cattery for a little while? So all those things we want to be looking at. So any kind of social or environmental stressors. And then, as we know, cats can struggle with a number of different things. And, again, we always look at physical health, mental health, social environment, and physical environment. So we always want to make sure we do a really kind of comprehensive evaluation of all of those things to see if stress might be present. So that's a massive kind of rule out, is sort of stress, distress, the environment not being perhaps ideal for that particular cat. Maybe we've got limited resources. Maybe we've got competition over resources. And we recently did an episode on feline resources, myself and Nora, so have a look at that as well. So all of those things can be really important. Maybe the cat is anxious about something. Maybe there are triggers in the environment that are causing anxiety, and the overgrooming is an expression of that anxiety. We can also call those displacement behaviors, right? And sort of overgrooming to cope with stressors in the environment. We could also consider that it might be attention seeking or a learned behavior. Is this something that the cat does and then there is a consequence that results in it? Either they maybe get attention from the caregiver, or there's something else that's reinforcing to them as a result of that. And that could also be internal reinforcement. So the overgrooming makes them feel better. Perhaps it initially started as a painful event, and the cat has learned that the overgrooming takes that away, releases some endogenous opioids, and it's become sort of an internally reinforcing event. So that's kind of the reinforcement and learning side of things. And then finally, it could be truly a abnormal repetitive behavior, also known as a compulsive behavior. Now, there's quite a lot of sort of discussion in the veterinary world as to whether we should be calling these abnormal repetitive behaviors obsessive compulsive behaviors or even compulsive behaviors, because that's very much taken from sort of the human terminology, the human diagnostic nomenclature. And I guess the thing that we always sort of think about is we don't know whether the cat is truly obsessing about something. So it potentially can be quite difficult to label it as obsessive compulsive, although there are different opinions and different schools of thought amongst veterinary behaviorists. Some say, yes, they absolutely can obsess about something, and others say we just don't know. So probably the terminology of abnormal repetitive behaviors, which is quite neutral and encompasses the behavior that we see, has probably come into favor more in the last few years. So we would probably diagnose that as an abnormal repetitive behavior. Okay, so let's say we've ruled everything else out. We've addressed everything else. We've addressed the stresses. We've made sure it's not a learned behavior. We've made sure it's not being inadvertently reinforced. We've looked at all the different kind of components in the cat's life, whether that's social or environmental, and we are left with it actually is an abnormal repetitive behavior. How do we treat that? And we have a couple of papers that look at the use of the tricyclic antidepressant clomipramine. So that's a TCA. And that has shown pretty good results. So that would be kind of, I would say, one of the medications that we can reach for. So clomipramine might be a good option here. And similarly, we can also look at SSRIs, such as fluoxetine or paroxetine, sertraline. There are a couple in that group as well. And those medications can oftentimes help to address the sort of the compulsive side of things. And it addresses the neurotransmitters that are perhaps out of alignment or dysregulated in this instance. So we're thinking particularly of dopamine in the case of abnormal repetitive behaviors, that big kind of reward neurotransmitter. And so, using a tricyclic antidepressant or an SSRI is oftentimes very, very helpful. And I will drop the papers in the show notes. They're slightly older papers. However, there are two that we have specifically on clomipramine for this particular use in cats. One thing I'll note is that oftentimes when we have abnormal repetitive behaviors, the dose of the medication that we choose, whether it's a TCA or an SSRI, sometimes needs to be higher than if we were using it perhaps for another presentation. So that's something to bear in mind. But obviously, we always start at the lower end of the dose spectrum and we titrate up if necessary. The other thing that we obviously also have to note when we're talking about medications is that there may be side effects, and that we also need to bear in mind that none of these medications are licensed for use for that specific presentation in cats. So there's no medication that's licensed for the use of abnormal repetitive behaviors in cats. So we would be using any medication off-label, and we need to make sure that we explain that to the client, the caregiver, and that they're fully aware that we're using the medication for something that it's not licensed for. That doesn't mean it's not effective. That doesn't mean that it's not necessarily safe. It just means that it's not licensed, and that's a piece that we need to discuss with the caregivers, and they need to be aware of that and informed of that, and they need to agree to use it even though it's not licensed. So that was a little bit about psychogenic alopecia or overgrooming. So I hope that's given you a little bit of an insight into that. So again, make sure you kind of decipher, is it really abnormal or is it a normal grooming pattern? And we spoke about kind of the 3 things to look out for there. Then we're looking at physical medical rule-outs, massively important. We're looking at any kind of stressors that might be in the cat's life that might be contributing or causing this. And then finally, if we've ruled everything out, we might be left with a diagnosis of abnormal repetitive behaviors, and we can treat that appropriately. All right, so moving on to pica. So this is actually an interesting presentation. And the reason that it's interesting and it really needs to be dealt with and it needs consideration is because we oftentimes see foreign bodies resulting from pica. And foreign bodies oftentimes or usually need some kind of surgical intervention, whether that's a full sort of exploratory laparotomy to remove the foreign body or whether it's an endoscopic procedure, but it certainly is going to require a general anesthetic and for that foreign body to be removed. And that's really important because these cats can sometimes be serial offenders if they, if they repetitively ingest something that gets stuck somewhere and it has to be removed. And I've certainly in my career had at least one case where we had a repeat offender, and after, perhaps 2 or 3 surgeries, the caregivers just couldn't afford to or didn't want to continue with surgery after surgery, and sadly that cat was euthanized. And again, it's one of those situations where if we know enough about the presentation and we know what we need to do, we can actually save cats' lives. So it's really important that we have a little bit of an understanding of what pica is and how we can manage and treat it. Okay, so let's have a think about what would the classic cat look like that performs these behaviors. So oftentimes they are young, very active cats, and they sometimes can be very, very driven by finding these objects, and sometimes they can be types of substrates. So it can be like plastic or rubber. Rubber is a really big one, rubber or any sort of kind of foamy rubbery material. It can be rubber toys, it can be hairbands, it can be flip-flop material, it can be kind of, cables and strings, that sort of thing. But it can also be materials like wool or cotton, and we'll talk about that a little bit more in detail because that's kind of a separate type of presentation. But it can basically be any cat that is very motivated and very driven to seek out and find these substrates, chew on them, and then ultimately swallow them. And that's where the problems come in, because if they swallow them and if they kind of get stuck in the wrong place, then obviously that leads us to what I spoke about earlier, which is, the emergency surgery to remove a foreign body. So we have to differentiate, again, as a little bit like I spoke about with the overgrooming, we have to differentiate normal from abnormal. And here I want to sort of stress that exploratory play behavior, where the cat might be kind of taking these objects into their mouths, that can be quite normal, especially if we have a young cat. They might have an otherwise maybe slightly impoverished environment. They might not have an abundance of toys, so they're looking for anything that they can maybe hunt or play with or practice those predatory behaviors on. And like things like hairbands and string are just the classics sort of for that. And we need to be really sort of observant in looking at, is this really just exploratory and play behavior? Are they just chewing it without swallowing it? Or are they actively seeking out these materials and then actually swallowing them? So that's the big kind of differentiation that we have to make here. So again, looking at normal versus abnormal, the diagnostic workup and process is always very, very similar. And that's a good thing, right? We always want to be going through the same motions. So number one, is it a normal behavior or is it an abnormal behavior? Number two, ruling out the physical, medical. You guys are going to know this drill now. So ruling out the physical, medical. And again, in any sort of abnormal orally motivated behaviors, we always have to think about a comprehensive physical disease rule out. So do we have any kind of dental, oral pain or disease? Do we have any kind of gastrointestinal disease? So we've got quite a few nice papers in dogs where we have kind of oral abnormally repetitive behaviors. So maybe repetitive licking of surfaces, that sort of thing, where we have gastrointestinal disease in a high proportion of cases. And I don't see why that should be any different in cats at all. So we absolutely want to rule out gastrointestinal disease. Do we have gastritis? Do we have IBD? Do we have any other kind of, gastrointestinal disease, whether that's parasitic, there are so many kind of differential diagnoses, but the overarching umbrella would be gastrointestinal disease. And then certainly pain as well. So I mentioned dental pain and oral pain, but it could also be a referred pain. It could be a referred pain from the GI tract, but it could be a referred pain from anywhere else in the body, really. So there are a couple of really nice case reports in dogs where we've had sort of abnormal repetitive behaviors and even kind of that pica behavior. So I remember one case report in a dog that was eating pebbles and stones repetitively, had numerous surgery to keep removing these pebbles and stones from the GI tract. Every time the dog went out to the beach, they would pick up a pebble, swallow it, and not just one, repeatedly doing so. And in the end, it was orthopedic pain, so pain coming, I think, from the hips and stifles, if I remember correctly, that was causing this behavior. And as soon as the pain was dealt with, the pica behavior stopped. So we need to think about that in cats as well, right? So we need to think about all kinds of pain-related behaviors or pain-related disease. And then finally, we also want to think about neurological disease. So it could be that we have an underlying neurological presentation that's causing these abnormal behaviors. So again, the full spectrum of physical, medical diseases need to be looked at, ruled out. We do that via physical exams, via various tests, and we kind of start to narrow things down and pinpoint whether that could be a contribution here. So that's really, really important. So again, abnormal versus normal, ruling out physical disease. We want to be addressing stressors in the home, right? We want to be looking at, is there anything that's causing the cat to kind of perform these abnormal behaviors, perhaps as a coping mechanism, as a displacement behavior? Is it attention seeking or a learned behavior? Again, we always need to kind of think about that. Is the cat receiving reinforcement inadvertently after performing or during performing these behaviors? Is it giving some kind of physical relief? So internal reinforcement. Is it soothing a pain, which takes us back to kind of the physical disease? And then finally, if that's not the case, we're left with our behavioral diagnosis, which again, we can think about an abnormal repetitive behavior here. So how do we treat these cases? And I've had a couple in my career that we've treated really, really successfully. Obviously, we go through the whole motion, ruling everything out. And if we're left with a behavioral diagnosis, then the first thing that we need to do is manage the environment. So is to reduce access to those items. And that can be more or less challenging depending on what it is that the cat is driven to ingest, right? I've had a couple of really interesting presentations. So one of the things that seems to be a popular substrate for cats to ingest is that kind of rubber grouting that you get around window frames. It can also be rubber grouting in bathrooms, that kind of spongy material that you either use for tiling or as a sealant around the bathtub or as a sealant around window frames. That's a very, very popular substrate for some reason. And so obviously it can be more difficult to manage the environment, but you can perhaps cover those things or reduce the cat's access. If it's in a bathroom, for example, you just reduce the cat's access to the bathroom. We make sure that things like cables or, phone cables, phone chargers, classic things, electrical cords and leads to PCs, laptops, lamps, you name it, all those things. We make sure that they're either put out of the way in case of phone chargers, or that they're maybe covered with something, or that they're hidden away, or that they're wrapped up really tightly so that the cat can't get access to those things. So managing the environment is a really big piece here. So just making sure they can't get to some of those things that they like to ingest. And then obviously we address all of the sort of stress related pieces. Do we have competition for resources? Do we have social conflict? Is there anything else going on in the environment? And then again, if it is a compulsive behavior, we have our medications that we can use. And again, they'd be the same as for the overgrooming. So we're thinking again about tricyclic antidepressants, so clomipramine in the first instance, and we're thinking about the SSRIs. So fluoxetine would probably be my first choice here. And I've had a couple of cases that have been really successfully managed with clomipramine. One really lovely cat who ended up moving to the UK, back to the UK, and that was a really successful outcome. That cat had been ingesting really regularly and had some issues. So that was a really great successful outcome. But similarly, there have also been those cases, as I mentioned earlier. This was before I started practicing behavior medicine, unfortunately, but that cat just, kept going back and ingesting new items and had numerous foreign body surgeries. So it's really, really important that we don't just fix the problem by removing the foreign body. We then also go to the root cause of it, which is why is this cat repeatedly ingesting things and swallowing them, and that they shouldn't be doing. Okay, so I want to finish off by talking about a different pica behavior, which is wool sucking, wool chewing, fabric sucking, fabric chewing, and has been reported in the literature to be overrepresented in Oriental breeds. So by that, I mean Siamese, Tonkinese, Burmese cats. So those are sort of our Oriental breeds. Now, there's been quite a lot of discussion in recent years about this as to whether that's actually appropriate, whether these breeds really are overrepresented, because the paper that actually looked at this looked specifically at Oriental breeds. So they actually sent out surveys through magazines of cat fanciers that had Oriental breeds. And the response back from the surveys were almost all Oriental breed owners. So you would think that would obviously skew the results in favor of Oriental breeds showing these behaviors. And we have to be really careful that we look at the study and we make sure we understand where the data has come from. So that kind of thought that it's overrepresented in Oriental breeds has fallen out of favor a little bit. So I think we can't say that as a diagnostic sort of criterion or as a risk factor. We can't say a cat being an Oriental breed is a risk factor for fabric sucking, chewing, ingestion. So again, we have a couple of papers looking at, why cats would perform these behaviors. And one of the things that's often talked about is early weaning or hand raising or bottle raising. Do these cats show an abnormal oral behavior because they couldn't suckle from their mothers for long enough, that wasn't an appropriate normal weaning process. So that's one thing that's often talked about. And there is actually a paper from Stephanie Bourne-Spiel from 2015 that found that, it was kittens that came from smaller litter sizes and that were early weaned that certainly were more likely to show those behaviors. So that's a paper I'm going to drop in the show notes as well. Things like intense appetites can be risk factors for showing these behaviors. So cats with, really kind of big appetites. But then for me, that kind of goes back to, hang on, is there something physical, medical going on here? Why does the cat have such a huge appetite? Is that because there's some kind of gastrointestinal disease going on, or are they hungry? Are they being fed inappropriately? So that's something that we want to look at as well. There are a couple of other things that are looked at, certainly medical conditions as well. So there are things, I think, in that specific presentation that we want to think about, but I don't think it's going to massively change the way that we treat the presentation. I think we're going to do exactly the same thing. We're going to go through the physical, medical. We're going to rule that out. We're going to manage the environment. We're going to look for stresses. We're going to make sure that it's not a learned behavior, or that it's not, an attention-seeking behavior. We want to make sure that it's not a displacement behavior, a coping strategy. And then if we've looked at all those things, then we probably end up with the same conclusion, and that it's an abnormally repetitive behavior, and we decide how we want to treat that. So yeah, just a little side note, because that's a slightly different presentation, that kind of fabric sucking. I've seen quite a few of these actually in my career, and I've seen cats that have actually chewed like massive holes into, a woolly blanket, or a towel, or, the owner's favorite cashmere jumper. And, when they send me the pictures, they're pictures of this bit of fabric with a massive, great big hole in there. So the cats actually do ingest these items, and they either, might cause foreign bodies, or they might pass through the gastrointestinal tract, but we're still looking at the same causes for the behaviors. Okay, so that's my whirlwind whistle-stop tour through abnormal repetitive behaviors in cats, and how we work them up, and the things that we need to think about. So, it's not hugely different from other behavioral presentations. We go through the same motions, we do exactly the same thing, and then we treat whatever it is that we find to be the underlying cause, whether that's physical, or other behavioral other than abnormal repetitive, or whether it's a true abnormal repetitive behavior. All right, I'm going to drop those papers in the show notes. I will also link to the episode on feline idiopathic cystitis. And I really hope you found this useful, whether you're a vet nurse, or you're a feline caregiver, or a non-veterinary behavior professional. I hope you found this useful, and it gives you a bit of an idea or a plan on how to kind of work through these cases. All right, I look forward to seeing you in next week's episode, and bye for now.